In general, our pacemaker or ICD patients are actually normal patients, and they can do everything. They can really continue their regular housework, what they actually normally is doing. But of course, there are some limitations, especially if they are treated by other doctors. So let's have a look. Imaging. Computer tomography is not an issue. Ultrasound, no interference. But if you use MRI, there is a potential risk of having interference during the procedure. Normally, we do have some new devices which are so-called MRI-safe devices. This MRI-safe device does not mean that all of the patients can go to any kind of MRI for actually regular imaging. It's strongly recommended to have the MRI investigation with the help of the cardiac rhythm specialist and electrophysiologist who can program the device properly. There are some other interventions like surgery, electrocauter, which could actually inhibit the function of implantable cardioverter defibrillator and even a pacemaker. What about lithotripsy, which is also a very often used method for treating a patient? You should be also careful if you work with that type of patient. Stimulation, nerve stimulation, muscle stimulation can also inhibit the function of the pacemaker. And there are very often cancer. And if you would like to treat a patient by therapeutic radiation, you have to take into account that this type of energy can destroy the pulse generator. And in that case, there is a need for replacement. I think education is the most important. So you have to start with the first visit after the establishment of the indication. So you as a doctor always need to tell the most important messages. Why is indicated, what about the function of the device, and of course why is the regular follow-up is needed. But even our nurses and assistants help us for actually patients just to know a little bit more about the device. And of course, after the implantation, the patient gets a small booklet and even internet webinar, which can be also used for further questions. Especially in my country and in my clinic, we are a big device center. So we implant almost 2,000 implantable devices. And that's why we have a huge patient flow. So we organize every Saturday morning a so-called pacemaker days. And we invite the patient, and they can ask any kind of question. And we deliver a small talk about the function and about the potential role of the pacemaker and why you can actually live as before. And if you take into account you are a healthy man or woman.